Yeah, exactly. When it comes to health, if it's not for you, do it for your family, do it for your friends. We all have a family member or friend that it was a notch on their belt that they hadn't seen a physician in years, right? I'm not saying you have to be at every appointment just to proactively check it, but take some responsibility. And if it's not for yourself, it's for your family, right? Absolutely. Because it can save your life.
Because who does it affect? It's like he said, ask his wife. It's the family members that notice. Yeah. Hey, Dr. Jacey Folkers here, I'm co-founder of Blokes and Joy, and we're on Everforward Radio today talking about optimization of men's health and teaching guys how to crush life and just take on the world.
3, 2, 1.
It was a great reminder for me to get back on track with the bare necessities of health.
Yeah.
Going back to get my physical.
Yeah.
Getting labs drawn, and not just like the basic labs, which most people don't even do, at least not even on an annual basis.
Right.
But then it was like, no, let me get more. My doctor's like, but you're fine.
Right.
You don't have these symptoms. Why do you want your, omega-3, omega-6, C-reactive protein? Why do you want testosterone? You're telling me you're healthy. I look at you, you're fine. I was like, well, I don't want to be just fine.
Right, totally.
I know my body. I've been with my body for 36 years now, and certain things just aren't cutting it. But also the range, screw normal. Like I don't want to be normal. I want to be me, and I want to optimize
Isn't it a shame?
as much as possible. It is. Yeah.
It's, I mean, this is, I don't like to bag on like physicians, but this is where I have my stick, right? I went through this pathway. I was told many, many times, like, you're fine, you're in the range, but my marriage is suffering. I'm getting fat, I have brain fog. I have all the classic symptoms, but you're too young, you're fine. Just chalk it up. And that's what most guys are getting. So like when we talk about stats, we're talking about true hypogonadism, but that doesn't mean there's not double the population of people who just feel like shit.
Right. Yeah.
Right.
Yeah.
Anyways.
And to your point, your doctor's saying like, why are you here? Why do you want to have this checked? It's because the Western medicine model is we want to treat symptoms. You're healthy until you have a symptom or until you have a diagnosis. But you're like, well, I just want to feel better. Yeah. And so like I was telling Josh, like what the question I like to ask people is like, so think back to when you were 20 and how you felt. And now today, compare that. Do you have the same amount of energy? Is your libido what it was? Do you feel? Do you have the same muscle mass and body fat percent? And if not, I mean, then start to like identify why.
And that was me.
That makes sense, dude.
I've been training regularly, like in the gym, strength training for 15, 16 years, and I've worked on strength. I've worked on physique. I've worked on all the things, and so I know what that feels like for me. And I know a lot of guys who regularly train or regularly active, what good feels like, what strong feels like, and what good looks like in the mirror, your interpretation of good for you. Right. And I was just like, it's not cutting it. And so it was a great reminder for me to kind of go back to that, because honestly, it had been actually almost 3 years at that point since I got physical.
That's crazy.
It's a whole other story with me not wanting to go to the VA as much.
Was that I mean, was it like just poor service? Was it a bad experience? Because, men are just less likely to go to the physician, period.
For me, it was really, I'll tell you honestly, the last time, I forgot about this. The last time I went and got my physical, I straight up was body shamed by my doctor.
That's fucked up, dude.
So I don't know if I've actually talked about this. I posted on social media when it actually happened. Wow. Dude. So I was 34. So like 3 years ago, almost 3 years ago. And I went in for my physical, went in to like get things checked out. And I was sitting down and the doctor was like looking at me. And he was like, kind of like, why are you here? Like, what's going on? You're fine. You're healthy. And I was like, well, haha. But I would like to get my labs drawn. I would like to check on certain things. And then like he was looking at my numbers, my height, my weight, looking at BMI, looking at my scale. And he's like, you're overweight.
Yeah.
And I was like, what?
Yeah.
And then I shit you not, he reached over, I'm getting my physical, my shirt's off, and he like pinched what I still got right here.
Interesting.
And he's like, all right, I tell you what, come back next time. I want to see you with a 6-pack. I don't want the 4. Full 6-pack next time.
No shit.
Wow.
Wow.
My doctor was telling
At the
me
VA.
At the VA. And in my head, I almost just walked out of the room, but I was like, you don't know me. You like, what if I'm getting through an eating disorder? What if I had disordered eating disorder? Also, my whole other dilemma with the VA is if you had actually looked at my history, you would see what I have gone through.
Yeah.
You would look at my orthopedic history, look at why I was discharged medically from the military. You would look and see that, and I bet you wouldn't say that same shit to me. When I spent a year and a half in and out of the hospital, in and out of rehab, learning how to walk again.
Wow.
You wouldn't tell me to come back with a 6-pack next time? Like, fuck you.
Right.
Yeah.
Crazy.
Yeah.
So speaking of the VA, this is my dad. He's 71. He's on our stuff. That's a real 71-year-old bro.
What?
Yeah.
Isn't that crazy, dude?
Yeah, we gotta zoom in on this or something.
So my dad's a Vietnam vet, and
this guy's 71. What? You guys, I hope you're watching the video. For
that's a Blokes patient, baby.
Yo, is he taking new clients? Like, I need to get it.
Right, yeah.
Damn. Like that's
he's jacked.
That reminds me of like Dr. Sean Baker. I mean, the carnivores doing crazy things, but that's incredible.
Yeah.
That's incredible.
Yeah. So we were digging a pool in our backyard, and what 71-year-old guy's going to come over and help do that? But Pops was there. So,
but I mean, I think that's a great reminder of like what, I mean, maybe we all don't want to look like that or, be like that, but just at 71, he's outside.
Yeah.
He's with his family.
Yep.
He's living life, being physically active.
Being physical. Yep.
And I guarantee, I probably would be willing to bet he's not like in pain and suffering after the fact.
Totally.
No.
Like that. I want that.
It's huge, dude. Yeah. It's huge.
Things like this, guys, like what should we really be thinking about long term to really begin to put things in place now?
Yeah, I mean, so we talk about it all the time. Like, in addition to make sure your labs are where you want them, your testosterone, sleep is important, staying active, moving, not overeating, sex life. So a lot of things that cause low testosterone also will cause them. So things like being overweight, for example, having extra belly fat. It raises something called aromatization. So the testosterone you do have will be converted to estrogen.
Jesse, would you mind just getting a little closer? I want to make sure people pick up on all this scientific goodness.
And so you have extra body fat that'll cause testosterone to go down. Low testosterone causes extra body fat. So it kind of creates this vicious cycle. So caloric restriction is important. Just, keeping track of your calories, eating less. I mean,
sunshine,
getting sunshine, like you said, being outside. All those things are super important. So just doing them on a regular basis. It's not about going to the gym once and expecting you to be. So it's an accumulation of these adaptations, accumulation of those things. So
can you give us a breakdown? I mean, beyond what you just did, of ways that we probably don't think are contributing to our testosterone lowering?
So one thing I like to give people are stats or numbers. So we were talking earlier about this. An average typical 50-year-old today, and let's say compare that to a 50-year-old 30 years ago, on average has 30% less testosterone. 30% less.
Wow.
So what contributes to that? So in the last 30 years, there's been a ton of changes environmentally. So there's a lot more plastics. I mean, I think, 1 million plastic bottles we go through like every minute or something like that.
You're talking about like microplastics getting into the body?
Right, exactly.
This has been a whole other fascinating kind of new discovery of mine, just this whole realm of microplastics in the body.
Yeah. And this is studied, by the way. This is not just anecdotal evidence. This is legitimate effects on the human body.
Yeah, shout out Dr. Christian Gonzalez, a naturopath here in LA, friend. He's been on the show before, put out an incredible podcast all around microplastics in the body, what it does to strength, fertility, longevity.
Yep.
Yeah, if you measure these guys that have low testosterone, there's high amounts of BPA, which is, what's in plastic.
Bisphenol A is what it is.
Yeah, correct. And so that's, in our house, I'm a girl dad. I have all daughters, but still, it's a xenoestrogen. So plastics cause estrogen to go up. You don't want that in women either.
Right.
So using plastic cups that are hot, don't drink out of those things. Using plastics to store your food, heating them up in the microwave. So just replace plastics as much as you can with glass or stainless steel. So that's a great, I guess, tool or something you can do now.
Yeah. And what about naturally? Last time I always looked was at about 30 is kind of when things typically go south for guys in natural T production. Is that right?
Yeah. Studies show that when you hit that 30, 35-year-old mark, it's only going to go down, right? That decline is no less than 1% per year. And that's just your biology. That's not including the external factors, which Dr. Folkers is talking about. But this is just life. Same thing happens with women as well.
Makes me wish, actually, I don't know. I would love to go back and see years ago, whenever I had my labs drawn,
totally.
If T was drawn, I have no idea. The only idea I have is the one that I got last year at my 36th birthday. I have no idea if I've been declining, if I've been maintaining. I do know now that I'm on the incline thanks to you guys, but that's just been within 6 months.
Sure. Yeah. That is kind of one of the things that we tell anybody who's young. Like, even if you're not a candidate for testosterone replacement, at least know where your baselines are, and I wish I could rewind the clock too, because it was such a dramatic experience for myself. I would love to know when I was in my 20s and my early 30s, and then when it really just started to tank and what that was like. But the only way I can even think about that is what I felt like when I was in my 20s and what I felt like when I was at my lowest of lows. And now what I feel like now, I just wish I would have never had that lowest period, but we're here now. So
let's talk about the feeling aspect of something that typically changes like how you look and your strength. And I'd love to get there in a second, but just so that we can kind of start with that association, I think it's so important. Like, how much more of a dad are you, a better dad, a better husband, a better you, when you feel better in those roles?
Sure. I'll dive into it first, but one of the reasons I created Blokes with JC was to be a better dad. And I'm on the spectrum a little bit older in terms of having kids. I just turned 40. I have a 4-year-old. I have a 1-year-old. And I started doing the math. I said, okay, in 20 years, my son's going to be 20, 21, and it's going to be time to have that beer, right? Yeah. I want to be a good dad at that point. I want to ski with them. I want to go to concerts. I want to charge with them just as hard as I'm charging now. The only way I'm going to be able to keep up with that is through some type of good energy and vitality. And this was honestly the solution, or the light bulb moment that just clicked for me. I'm like, holy shit, I can keep up with my kids right now. I just told my wife this literally this week, because being a dad is hard. It's a lot of energy, and we're in that really active period. And sometimes the best time is when we put them down to bed. But I told my wife, I said, I don't know what I would do if my hormones weren't checked right now. They weren't balanced. One, I'd be a moody prick. One, I'd have no energy. I'd be sitting on the couch watching you try to keep up with the kids when I'm not helping. So when we talk about just being the better version of yourself, that's truly what we're trying to solve. It's not about pumping weights. It's not about taking your shirt off at the gym. It's about feeling good. It's about feeling the best version of you. And there's so many light bulb moments, and you can probably attest to that too. And it's interesting because it happens in stages: 2 weeks, 4 weeks, 6 weeks, 8 weeks, and then you're just feeling great and optimized. But that's been my experience.
The feeling has been incredible. For me, what I noticed the most at about the 2-3 week mark was my enjoyment for being active and training came back in a way that I didn't know it was gone that much. I had a little bit of, honestly, demotivation.
Sure.
Because like I was saying earlier, I was doing all the same things. I was, I know how to train. I know how to eat. I know how to sleep. I know how to do all these things that I know contribute, when consistent and optimized, contribute to my personal wellness goals, physique goals, strength goals. But that just wasn't there. And I had gotten demotivated. Like, I was having to really talk myself up more to go do something that I used to love so much and gave me all this positive feedback. But I would be like, all right, just go to the gym, just go. Like, okay, I'm just going through the motions kind of thing. Like, what's the point? But then 2-3 weeks in, I'm just like, I love this. Like, I'm looking forward to training. I love how I feel in the gym. I love feeling that kind of threshold and leaning into pushing past that threshold in the gym. That was the biggest thing for me, which I wonder how many other guys out there are suffering from demotivation and don't even know it.
Mm-hmm.
Yeah, you guys both said so many good things. So just kind of like replaying like some things I've heard from patients and what they shared with me and what I've experienced. First of all, the male brain has a lot of receptors for testosterone. So when you're not having that, feeding the testosterone to the brain, you lack drive, you lack motivation. What a lot of us don't realize is how crappy we feel. We don't realize, like, you know, that's why I asked, like, okay, what were you like 20 years ago? And now compare that to now. I just talked to a guy the other day. He said, you know, he's 50 and he's like, well, I want to get on your program, but you know, then I'll have to do all those things. I'll have to start to exercise, and like you said, you realize right now you don't have the energy to do those things. But let's add this. Let's optimize you, and then when you have energy, you're like you said, you want to do those things. You're like, I enjoy this. And so a guy just said the other day, you know, I didn't realize how bad I felt. I'm on testosterone now. I feel so much better. Guess what? My wife appreciates me more because I'm helping her around the house. I'm being a better dad. Like, you don't realize how much you're selling yourself short.
Oh yeah.
When what's going on inside of you. And so what you tend to do is blame the wife, blame the dog, blame or whatever.
Job. Like, I'm too tired because of this reason. Yeah. Like, you know,
right.
Like, there's a great example for like extreme ownership. Like, what if it's you?
Right.
What if it's you and you don't even know it?
Right. I think testosterone is really interesting because it's not an acute pathway, right? For most guys, like this guy you're talking about, it's taken years, right? You know, let's just say he was in the average norm range in his early 30s and he's 50. Well, if you haven't addressed that and if you haven't truly taken notice, a lot of times the partner is the one that notices it. You know, the motivation for me was my wife. She's like, listen, dude, you don't get your shit together, you're out. Mid-30 guy, about to get divorced because I had no sex drive. My testosterone was just out of whack. And you didn't even know that. So a lot of times it's a slow progression. And then a lot of times you're not even noticing that. It takes the partner to notice. So.
And like Josh said, like we said before, a lot of, we ask guys, have you had your testosterone checked? The first thing they say is, oh, my libido's good.
Yeah.
Because that's what they equate it to. Yeah. And so with like the word depression, a lot of times people, when they hear that word, they think mopey, sad. With men, depression is more like snappiness, being grumpy.
Yeah,
it's a different,
Oh yeah. That was me.
And so think about what that does to a relationship. Who wants to be around a guy that's just an asshole, in a bad mood all the time? It's because he's lacking something.
Yeah.
And, getting your levels checked, getting those things optimized makes a huge difference because it makes you just a better version of yourself. So,
well, now let's lean into kind of maybe the more preconceived notions about testosterone.
Sure.
I had them. I was like, my libido is good. My energy's fine. I'm looking for this specific reason, which is very valid. Whatever you want to do to manipulate in your life and your wellness, that's up to you. But then like all the other things kind of just made sense as they were progressing. And I was like, oh, I didn't know, to your point. Like I didn't know I was kind of snappiness. I didn't know. My wife would say I definitely get moody in general. I'm kind of like, sometimes I have to snap myself out of it, but that was happening more than I realized. And so let's get to kind of like maybe the more preconceived notions of sex drive, of strength, of the physicality of it. What can someone expect to have happen regularly using TRT, and maintaining, or if not even increasing their training, their physical activity?
Yeah. So first of all, if somebody is experiencing issues with libido and or erectile dysfunction, that almost is always low testosterone. So, and if it is testosterone and it's not like, for ED, and it's not a circulatory issue in and of itself, then they will see improvement there pretty soon, pretty quickly.
Yeah.
Now, with regarding, building muscle recovery, and, that's also part of it. So they, just ask, how fast did you experience improvements in that in yourself?
I began to notice it around like the week 3 mark.
Yep.
I was getting feedback from people, friends in the gym, by about like week 5.
Yeah.
Yeah.
One thing that it's really interesting, before we created Blokes, I was a patient in this category, right? And the physician I saw at the time asked me a question. He says, how's your morning woods? I didn't even think about that, right? How often are you thinking about a morning erection, right? And it took me a second. I don't even know if I gave an honest answer. I was like, I think they're pretty good. But then I actually went home and I thought about that. And I noticed that I don't have erectile dysfunction, but I didn't have an active sex life. And I definitely wasn't getting those morning erections. As soon as I got on TRT, within weeks, I started getting morning wood almost 5-7 days out of the week. Wow. And that in itself stimulated so many things, right? Just made you wake up better.
Yeah.
It increased your appetite for sex, which is so important in any relationship, for so many different reasons, physically, mentally. But that was a really quick indicator for me. And when I knew it was working, outside of the usual suspect, strength, drive, and all that good stuff. But that was something my wife noticed right away too.
I bet, yeah.
And it was a good thing, right? Especially coming from, a bunch of goose eggs. So that's something they'll notice pretty quick.
I also really noticed, speaking with like the physical stuff still, I was able to just really go more. I felt like I wasn't fatiguing as much. Like when I would normally get into, I typically, for my main lifts, I like to train heavy in like the 3 to 5 rep range traditionally. And then afterwards, I kind of just have fun with accessory, 10 to 15 stuff. But honestly, I felt like what I was doing for reps of 5, like I could easily switch to do 8. Nice. And I like, the strength was there. For me, strength kind of ebbs and flows, but once I get back in, like within a week, my strength comes back, personally. But I just noticed that I wasn't fatiguing as much in the same rep scheme, the same weight, which is a whole other positive feedback loop of cool. I'm able to do the same weight for more, which I know is like feeding that motivation loop, but also, I mean, it's going to feed into the physicality as well. Sure. Like I'm going to get stronger, I'm going to build muscle and maintain muscle.
Well, like one of the worst things getting back to any type of routine or exercise is getting sore, right? And that was something that there was 2 things. One, I was really motivated to go work out, but 2, the recovery was insane. My sleep was so much better. And like you said, I'm not necessarily pushing a ton more weight. I'm not trying to do that. But the fact that I can do more reps and feel better, less fatigue day after, it motivates you to keep coming back, right? And that's a huge mental thing, right? Especially when you're coming from guys who have been blocked for weeks, months, years to not even hit the gym.
And back to those 2 topics. So like I said before, a lot of guys have low testosterone, but they don't necessarily have low libido, and so I'm good in that. But as far as the working out, I mean, some guys, they're not working out, but even getting your testosterone optimized, you may start to notice loss of fat. Your clothes fit a little bit better, a little more a definition of shoulders and your arms. So adding in that physicality, the exercise, I mean, it's just, just icing on the cake. It's just really, I mean, we encourage everyone to exercise. I think it's just, you just move, at least go for a walk.
Move more, people.
There you go.
Exercise.
I mean, our bodies are meant to move. And I mean, it's vital for longevity, for optimization, for everything. So.
Yeah, and motion creates motion, right? Like the more movement and the more active you are, the more likely you're going to continue doing that, right? On a regular routine. And for a guy like me who was getting fat and tubby, it was rough to get back in, and it felt really good just to get back in that rhythm. I mean, I was an athlete. I played rugby for 12 years of my life at a high level, and I forgot what that feeling felt like. To get back in the gym and just feel strong and feel, I mean, for lack of words, more masculine. Which I think we're, slowly losing in society.
Totally.
It felt good. It felt damn good. And it felt good to be behind this type of business.
Oh yeah.
I mean, it's good for immune system, immune health.
Also,
So you ever notice how a lot of people get sick or get ill in the wintertime?
Oh yeah.
So we're just in general more active, in the warmer,
More sunshine.
Winter comes around, you move less. So like our circulatory system has a heart that pumps blood throughout our body, but our immune system does not have that. So it relies on us to move. So continuing, keeping your body moving. That's why we try to make it our kids during the winter months be active. We move with them versus being in school sitting there and
just hibernate.
That's so movement's so important for all those things, but overall health, longevity, immune health. I mean, that's pretty much all part of it.
How dare I say the C word, the big COVID word, but they're now
Instagram gonna post.
This is good. This is a good thing, right? When the pandemic first started happening, there was a lot of thoughts about high testosterone levels being less effective towards COVID. Now they're studying.
Meaning high T being associated to less likely to get COVID?
No, more likely. That was the initial interpretation and understanding. Now that's been completely debunked.
Well, we were looking for any correlation to kind of make sense of all this stuff. Yeah,
totally. And
I hadn't heard that one.
No, totally. I think the University of Washington just did a small study on it, but they showed that if you had higher or more optimal testosterone levels, you had a better chance of fighting the actual disease. And when you think about it, if you probably are more in that range, a better range of testosterone, you're probably less fat, and COVID lived and breathed in, obesity and fat, right?
The bare minimum, I think what a good biomarker tells you is you're obviously doing something right.
Exactly.
So high T, or high HRV, low resting heart rate, low respiratory rate means, excuse me, listeners, just like a genetic gift from God. Odds are you're doing a lot of things to contribute to the immune system, to circulatory, everything.
Yeah.
Well, totally. Like other like pathological, conditions like cardiovascular disease, prostate cancers. For a long time, there was people that thought, doctors even that thought that high testosterone led to heart attacks.
Right.
High testosterone led to prostate cancer, but those things have been debunked. In fact, there are research that shows that high testosterone actually helped prevent cardiovascular disease.
Now, I wonder, is that traditionally because, sorry to cut you off, but we assume high levels of testosterone is associated to high levels of like aggression, i.e. high levels of stress. So I think the argument could be made that highly aggressive guys, high T, high stress guys, you're just more snappy. You're running at a higher level of stress, i.e. more, heart attack potential.
And I, not to cut you off, but I think, I think,
it's a flow.
I think there's two distinguished differences, right? There's optimal testosterone levels and then there's high testosterone levels. I think the misperception of high testosterone is meatheads, bodybuilders who, from the 70s and 80s and 90s and still to this day have a really bad issue with illegal testosterone. We're talking about optimal levels here, not so far above, let's say 1,200 nanograms per deciliter. We're talking, between 700 and 1,200 nanograms per deciliter. There's a big difference. And that is, I think, one of the barriers that we have as a company is getting beyond the misperception or bad perceptions of testosterone, right? All we're doing is replacing what we think should be there for your age, right? We're replacing what helps you just be better day to day. We're not going to get you to the Arnold Classic, right? We're not going to be, actually, we won't even treat those type of patients because it becomes malpractice. They're testing out of the gym. They're lifting out of the gym. It becomes concerning and it a liability. So we have to be careful with that. But I think there's two distinguished things. There's optimal levels and then there's beyond optimal levels and high. Just think about a bell curve. There's the low side of it too, right? You want to be right in that middle, right? Yeah. At an optimal range.
Your sweet spot.
Exactly.
Yeah. Josh he's referring to like super physiologic levels of testosterone, which is kind of like you see the magazines, the guys that abuse it, they're like, gorillas more or less, they're just like huge muscle bound. And, that is going to put, it's like almost no different than a morbidly obese person that has all this extra mass. That's putting a lot of stress on your heart.
That's a great way to put it.
Now, to your point, like the guys that are aggressive, is snappy, and that kind of a thing, and maybe don't handle stress, that actually correlates with low testosterone, the irritability.
See again, so here's like a commonality that we're debunking. That's what I always thought.
Yeah. And so being more, here's the thing, being in a more optimal testosterone level is going to make you more of who you are, so if you're a nice guy and, and it just kind of even killed, it's going to, make you more
like your homeostasis.
Yeah. Sure. More of that. And so, there's some misconceptions about that, I think people think testosterone, they think aggression, right? When,
that's what my wife said. When I told her, I was like, I'm starting on TRT. She's like, oh God, you're going to get so moody. You, don't get so big. Like, it was just like all these myths that she thought were going to come true.
You want to know what the most aggressive creatures there are is a mother protecting her young.
I believe that.
There's not testosterone playing into
Nobody messes with mama bear.
Right?
Yeah.
So I give the analogy because I'm not the scientist, right? I give the analogy of what I was like before testosterone. My glass was always full, right? And if I took a small drip of anything, it was already overflowing, right? I try to do the best I can with managing my stress levels. It just is what it is. I'm going to have a high stress level probably the rest of my life. Hormones have allowed me to manage that better and more efficiently. So now I give
that you're aware of that.
Totally. And now I give the analogy, like my glass is halfway full. So if I put a little bit extra on or a lot extra on, I can manage that day to day so much more efficiently. And that is why mood swings are one of the most common low T symptoms. And people don't even think about that. They just think about erectile dysfunction. They just think about libido. And those are two of many, right? But optimal testosterone levels just help you balance and manage life on a day-to-day basis.
Be you.
Totally.
Get back to you, be a better you, just be you.
Yeah.
I'm curious, can you, Dr. Jacey, can you maybe walk us through do's and don'ts, safe protocols, like maybe what are some ways that somebody, let me backtrack. I think when we look at TRT, like a lot of the preconceived notions we've been talking about, there's also kind of the fear of how to do it correctly. I think of the funny part, my brother and I did recently. It was like, if there's an air bubble, you die. You dead. He's like, no air bubble, you're fine. It's an air bubble death. I was like, no, first of all, you're an idiot, Max. But also there are half truths, misinformation out there about how to do it safely and effectively, which is another reason why I love working with you guys and using the Blokes product, is because you have such a great onboarding, you have great instructions. I'm kind of an anomaly. My wife is a nurse practitioner. So I'm just like, hey babe, watch me kind of thing. But do's and don'ts of TRT.
Yep. Yeah. The first thing I think do is get tested. There's a lot of guys out there getting testosterone from,
without even knowing your baseline,
from guys at the gym, from buddies or from
knowing the source,
and not getting their blood checked initially, not getting follow-up labs, not seeing where they are. And we look at other markers in addition to just testosterone. We're going to look at red blood cell, hematocrit, hemoglobin, estrogen, free testosterone, total testosterone.
Can I ask you why? What picture does that help better paint on your side?
For those markers? So if, in some individuals, when they start TRT, it'll cause their hemoglobin to go up, their red blood cell count to go up, their hematocrit. So this is essentially thickening their blood. So their blood becomes more viscous.
Coagulating.
Yeah, more viscous. And so this can pose a threat to clotting, stroke, that kind of thing. So you got to manage that. You have to check that.
That's huge.
We had a patient that came to us, a friend of ours. He was with another clinic, and he in his 30s, and he was with another clinic and had a heart attack.
Yeah.
On some sketch TRT?
Well, they weren't monitoring him. They weren't,
okay.
We won't say any names or anything. But it's like there's so many guys out there just not being monitored. So there's
other factors to your health that aren't being considered when manipulating something as powerful as TRT.
And the importance in any patient's evaluation process should be how often and what type of blood markers are you checking. The analogy I give is if you're pushing, peanut butter through your blood vessels, it's a lot different than pushing water, right? So your heart and your body and your metabolic rate is working so much differently, right? And the only way to do that is by symptomatic feedback, consultations, but also blood, right? It's not uncommon for guys' blood viscosity to get a little bit thicker as they're on testosterone, and it's really easy to treat that. But if you're not getting those regular checkups, it's really hard to treat it.
Yeah.
Yeah. So we, you know, if once we detect that, you know, increase RBCs, hematocrit, hemoglobin, we'll say, hey, you know, go donate some blood or go get a therapeutic phlebotomy done and that helps, you know, often, maybe sometimes we'll have them stop the testosterone for, you know, a period of time. And then once we recheck their levels, they're good again. But it's proper management. And so another thing I'm a huge advocate of is something called split dosing, which is...
We started doing that with me.
Yeah.
After my last check-in. Yeah.
Yeah. It seems like guys just...
like I'm microdosing everything in my life.
Yeah. And it just seems, you know, because, you know, when you think about it, if you give a large injection, large amount of testosterone once a week, I mean, you're going to be at this peak and you're going to feel, and then it kind of drops off versus splitting that in half, you know, twice a week. And that seems to really help with those other markers, estrogen, estradiol, hematocrit, hemoglobin, and it just kind of keeps you more even keeled throughout the week. So huge fan of split dosing. And so that's another do that we, you know, split dose as well as starting low, you know, don't start a guy at a super high, you know, dose. And, you know, that's why we really do an individualized approach with TRT. We don't just like have every guy on the same dose.
All individualized.
And I notice a lot of other clinics will automatically just start every patient on an anastrozole, which is an estrogen.
What's that?
So anastrozole is a medication that blocks estrogen. So it keeps estrogen, it actually prevents the testosterone from converting to estrogen.
I remember this came up because actually my first follow-up, it was like the estrogen levels had gone up.
Sure.
Right.
And so it was, hey, do you want to go on? I think it was that medication to kind of like bring this down. And so I was like, what are the options? And we decided to do that. We went with like the split dose, a little bit lower dose, and, you know, all good.
And here's the thing, you know, estrogen itself, it seems to be demonized a little bit. And a lot of guys are always like, you know, do whatever you got to do to keep estrogen down. Estrogen is just as important for men as it is for women.
Please, why?
So estrogen is important.
Guys, pay attention.
For actually, a lot of the things we attribute to testosterone, like libido, actually estrogen. If you have low estrogen, you will not have libido. If you have low estrogen, it's going to affect your joint health, your bone health. All those things are important. So when I see a little spike in estradiol, I'll ask, do you have any symptoms? Do you have water retention? Do you feel nipple sensitivity? You know, which could be like the beginning of gynecomastia.
I remember being asked that. I was like, what?
Good question. Do I?
Maybe back when I used to run, like, to get shaken from my shirt, but you know, Band-Aid would fix that. But,
and so we asked, because like if your estrogen is a little high, it's like we're not going to like knee jerk. Oh, here's some anastrozole. It's a hormone it's about the ratio. You want to have a good ratio of testosterone and estrogen. And
what is a good a typical?
Like 20
to 1.
Yep. Okay. Is ideal. And so
T to estrogen.
Right.
Okay.
Yeah.
And a lot of that misperception comes from that bodybuilder community. Once again, you hear the verbiage in bro science, right? Bottom out your estrogen. And, you know, it's not really actually good practice. And when you're prescribing, you know, hormone optimization.
Well, I competed. I kind of, you know, have a soft spot for bodybuilding, but it's not a healthy sport. It's
not in the long run.
It's not.
It's hard on the
especially
body.
when you are like trying to get your, you know, super peeled, super like cut, super dry, which that's why you get your estrogen down so low, because you don't hold it down in your water.
Okay.
Estrogen is going to cause you to hold that water, so you won't be able to see the definition and like the vascularity when you have a little bit of estrogen. So that's where that kind of I think comes from. But estrogen is more important to overall health than we realize. So
especially for guys, I'm hearing.
Especially for guys.
Oh, interesting.
Yep.
Let's shift gears a little bit to another thing that I just started with you guys on, peptides. What are they? How are they conducive to maybe T levels and what, you know, everything we've been talking about, optimizing for your norm. And I'm very fascinated by them because watch them, see them all over the place. I feel like they're kind of like a new pioneer in health optimization and especially longevity. So what's going on in the peptide world?
So peptides, just to give you the kind of definition, it's you know what protein is, right? It's this long chain of amino acids. Peptides are short chains of amino acids. They're already in our body, you know, going through our system, doing things. So they function more specifically. So they're going to go do things to your pituitary, like help secrete more growth hormone.
That's the other thing.
Testosterone is a hormone that does a lot of things that we kind of talked about. Peptides are kind of a little more specific.
Okay.
So like BPC 157.
That's what I'm using.
One you're using stands for body protective compound. So what it's going to do, it's going to help repair tissues. It's going to help repair digestive conditions if they're there. It's going to help reduce inflammation. And so it can also, because it's going to help reduce inflammation and help everything function better, optimize the utilization of testosterone. So so peptides are kind of more specific. They're more signaling. They're kind of going to your cells, helping them function a little bit better. Whereas a hormone like testosterone kind of just does a lot more global thing. Also has an anti-inflammatory component. But yeah, peptides are exciting. There's a lot that I
can speak personally to that, what you were saying about the recovery and healing aspect. When I first started on them, I kind of like re-injured basically an injury I had on my back that I just got right before starting TRT actually. Just got carried away, was feeling super motivated, deadlifted, pulled some weight that I normally would never do without a belt. And I was just like, oops. F it. I pulled it, but then like something happened. Not like my spine, but just like, you know, kind of like low back. I don't know, it was like my psoas or something, but just like my back muscle was just like, I was out for like 2 weeks. Yeah. Like no load bearing, no squatting, no pull, no like nothing. And then I was on T, and then the peptides. I was tiptoeing my way back into load bearing. I was under the squat bar actually, and just like dropped down, re-injured it again. But 2 days later, I was back to normal.
Wow, that's incredible.
That's 2 days versus 2 weeks before.
Yeah,
the BPC is one of my favorite peptides because it's, you know, you're taking an oral form. Obviously. Right, yeah. Patients can take an injectable, so you can actually, if you have an injury, like I was injecting it directly into my shoulder,
straight to the site,
just jacked up, and it like healed it faster than any ice and heat and any kind of rehab. But it's great for local pain. I just injected someone Josh's neck this morning.
Yeah,
like walking through
literally. Boom. I was like, I slept on it wrong, and I'm like, you know what? I can't shake this thing. Let's throw some BPC in it. Let's see what happens. I think BPC is one of those that is it's not like testosterone where you're like, man, I'm really feeling it. Right. You got to almost step back, and then you're like, wait, did that just happen? Mm-hmm. And I'll tell you, my aha moment with BPC was I wrestled in high school. I cut a lot of weight. I did a lot of damage to my bowels, and just cutting weight at a young age is not necessarily healthy. And I was in great shape, but I was playing pickleball with my wife, and I messed up my Achilles. And you know, I'm 40, right? I mean, things just aren't recovering the way they did.
We don't bounce back.
Exactly. And I'm injecting my Achilles with BPC, and I'm like, wow, there's no way this feels better. And this is like 3 or 4 days. Well, I kept doing it. And then I noticed, which I've been dealing with this since I was, 18. I've just had really weird bowel movements for many, many years. All of a sudden, my bowels were just cleaned up.
Really?
100%. Like
in terms of regularity.
Yes, regular. Exactly. Consistency. Just, I mean, exactly. When a lot of guys, they go through life, and as soon as they eat, they're going to the bathroom, right? I was able to just process food differently. And that was just this one little weird thing that I didn't even pick up until weeks later, because I just kept doing it. My Achilles healed, and now I'm kind of addicted to it, just for the sense of better bowel movements.
Which, I mean, that's a huge indicator of overall health. I mean, if you're not eliminating regularly, the right consistency, I mean, that we know is a great telltale sign of a lot of other potential health, gut problems, immune system. Wow, that's powerful.
Yeah, I mean, we're on this big verge of discovering leaky gut and what the heck that does, right? And the damage it can do to your body and inflammation.
Poor gut health, poor brain health.
Exactly. 100%. Absolutely. I just felt better, right? Like it was just like one of those symptomatic things where I'm like, I got to continue to take this just to feel better. That's it. So it's kind of one of those magic ones, if you ask me.
it's derived from gastric juices, so it's kind of like that's why it does so much for healing. There you go. For healing the gut. Yeah. We have a patient. I just thought of a story. He for years suffered from like chronic acid reflux. He's taking proton pump inhibitors and tried everything, and we got him on BPC, and he within a month was like, I got off the proton pump inhibitors, and this is something I've been dealing with for like 10 years. So it's amazing for healing people that have ulcers, people that have Crohn's, leaky gut, any kind of, gastric issues, but also musculoskeletal issues. So it's like, we call it the Wolverine peptide because
my attention. I just keep saying that right? Whatever it is. You attach Wolverine to anything.
Yeah. Right. Yeah. So it's one of my favorite peptides because I felt the amazing benefits of it just from, injuries I've had.
Yeah.
So
I think one of the things for your audience to realize is this is not new. Peptides have been around for years. The most common peptide in the world is insulin, which your body can't live without. So, there's plenty of FDA approved peptides. There's plenty that are being compounded in pharmacies. Just make sure you're getting them from the right source, just like anything else. It's under medical supervision. There's a lot of naysayers or bad actors on the market that are doing cash grabs. And, whether it's through us or anybody, just make sure you're getting it from the right people.
I want to go back to something you were saying about getting on something can help you get off of something. I think that's a unique aspect that I haven't really thought about.
Yeah.
And that's oftentimes we don't want to take something else. Like I don't need another pill, another supplement, another thing to do in my day. But we've been definitely covering a lot of things that can be made better by this additional thing, things, peptides, TRT. But the ability to get on something that especially is naturally derived that our bodies are already creating so that we can maybe then get off the acid reflux medication, get off, and I'm sure a myriad of other possible medications that tend to have unwanted side effects.
For sure.
So can you shine a light on getting on something to get off other things, and why is that a good thing?
Yeah, I mean, well, in my opinion, so let's differentiate drugs, pharmaceuticals from peptides. So medications, people oftentimes are going to be prescribed a medication because they have a symptom. So the medication is trying to inhibit or the body a process or force a different process that's happening to address that symptom. Peptides are not doing anything to force your body to do anything. It's just guiding your body to do what it's already knows how to do.
Love that.
Right. So
love that description.
So it's like you can take a peptide like a BPC, for example, and it's going to kind of help your body heal and repair. And even if you stop taking it, the healing and repair has occurred. So do you need to take this anti-inflammatory? Probably not. Do you need to take this painkiller? Probably not. You need to take this opiate? Probably not. You need to take, so it's helping your body do what it already knows how to do. So you're just providing that innate ability that's there and just enhancing it. So that's, a lot of the other peptides do the same thing. We have nootropic peptides. We have, peptides for growth hormone optimization. And it all kind of follows that same premise.
All right. Now I'm going to kind of like put my foot in my mouth and play devil's advocate here. What about the mindset or the approach of, all right, well, I don't want to take anything supplemental. I just want to I want to improve my mood. I want to reduce brain fog. I want to get stronger. I want to repair faster. I think you probably could find a way to maybe make all those markers better. But like, let's be honest here. Like we've been saying, at a certain age and ages, biology just doesn't work in our favor as much. So what do you say to the guys, the people out there that have that belief system when looking at this? Like, I don't want to take something just like, this is an easy fix. This is an easy way to get better, to be stronger, to have quick fixes in my life.
I will say this, just on a more anecdotal perspective, we're going to help you get to that finish line a little bit quicker, but you're still doing the dirty work, right? You still have to make the lifestyle adjustments. You still have to lift weights. You still have to have an active lifestyle.
You got to be committed to.
You got to be committed, right? And we have a lot of patients that come to us and are looking for the quick fix. Nothing is quick about this stuff. You got to be committed to the program. You got to be committed to change, and you got to embrace that change, because it's just as easy to take a shot of testosterone and go sit on the couch, right? There's going to be nudges and there's going to be things that are happening in your body that allow you to get there quicker, but you got to accept it too. But I also tell people like, listen, if it's not broke, don't fix it as well. Right.
Yeah.
But I'd love your opinion on that too.
Yeah. So, we talked to a lot of like biohackers out there. They're doing all those things, and they're kind of, a lot of them are hitting kind of like a wall. They hit a hump, and they feel like, as we age, certain things diminish. Let's say you're doing everything imaginable to get your testosterone to optimal level. You can move it to a certain degree, but chances are it's not going to get back to 850 or 900 like it was when you were 20 years old. So a lot of the peptide things that we will prescribe kind of act as like a catalyst, like Josh is saying, to kind of get you to feel better and kind of get past that hump, get over that hump. So you can start to like, now I'm where I want to be. And then, you don't have to take these things forever. You don't have to be on semaglutide, which we even talked about, which is a weight loss peptide, forever. You can reach your goal weight.
Yeah, I'd love to get there. Yeah.
Get off of it. But it's the same thing with BPC. Get your recovery out of the way. And then, like you said, you hurt yourself doing some deadlifts. You probably would have been out for a lot longer, but you're back lifting.
Yeah. 2 days.
That's pretty crazy. So that's you don't have to take these things forever, but I like to view them as catalysts or things that kind of like help get you to where you want quicker.
What is the long game expectation with something like TRT? Is it the thing that, I know it's a commitment. Is it a thing that like, all right, a year of my life, 5 years of my life, 6 months, can I come back to it? Do I need to cycle it? Like what's the long game here?
That's a good question.
So we get that a lot.
It's the number one question. If I'm on it really is. If I'm on TRT, do I have to be on it the rest of my life?
Yeah.
And I'm going to let you talk about it.
And the answer is you don't have to be on it the rest of your life. But chances are, as we kind of seen, is chances are you're not going to. Let's say use a hypothetical. Let's say you're at 350, and you're 35 years old. 36 years old. Chances are when you're 40, your testosterone is just going to shoot up to 800, but unless you get on testosterone and you're at 850, 900 or whatever, if you get off of it, you won't stay there, but you might drop back to where you were or lower. So to answer your question, it's not something that's going to, it's replacement, testosterone replacement,
right.
But it's not going to stimulate your body's natural production and allow you to maintain that degree of testosterone when you get off of it, or if you get off of it. But
so it's not like something I can use here and now to get my body to like do it all on its own and then like wean off kind of thing. But do I need to cycle? Do you recommend cycling? Or like, I'm sure that's based on a lot of parameters.
There are some there are numbers. Yeah, we don't really advocate cycling. It seems like guys that cycle kind of just they get off of it, they just revert back to where they were.
Yeah,
which is, like I said, you're not going to like just get on testosterone, and it's not like a peptide where it's going to stimulate your body's production and keep you there. It's replacement, so it's replacing what your body's, which isn't bad, but it's because where you were, chances are your body's just not going to like through lifestyle, he's going to move the needle enough to make a difference. Okay, does that kind of make sense?
Yeah.
Go back just to basic biology, right? When you hit that 30 mark, there's the likelihood of it going up are very, very slim, right? And most likely it's going down. That's the only place it's going. Two things to understand: endogenous and exogenous, ways to increase. What we're doing is an exogenous way. We're replacing it with a bioidentical hormone, right? Yeah. The endogenous side is really tough, right? Especially for guys who are experiencing low T. You're asking them to change their whole lifestyle. How? When? I see so many different ads and, things in social about how to increase endogenous testosterone. It's extremely hard. And I can tell you, it's certainly probably not going to be through some test booster that you're getting at GNC. It's just the only true replacement of testosterone is testosterone.
Yeah. And I felt like I was kind of that guy. I was like doing all the things, like I'm regularly training, I'm sleeping well, I'm outside in the sun, I'm, checking off all these boxes to make my body as conducive as possible to keep and to make new testosterone. But
And
35 came knocking and
totally. And we talk about this all the time. Like there's all kinds of noise about natural ways to increase it. There's herbs and ashwagandha is a big thing right now. Everybody's talking about, right?
It's amazing.
Yeah.
You know,
use it every day.
I've read a couple studies on it, and these are true hypogonadism patients. So let's just say a patient in that study is somewhere in the range of 200 nanograms per deciliter. The study is showing anywhere from 20 to 30% increase in testosterone, but let's extrapolate that. 220%, that's 40 to 60 nanograms. They're still likely in that hypogonadism range.
Yeah.
We want our guys to be optimal, and taking a guy from 200 to 600, 800, 1,000 nanograms is what we're trying to do. That's true change. That's not 20% of 200. That's a lot. That's a big difference. And there's nothing clinically that is out there that is showing it can do that other than testosterone. So,
well, this is going to be coming out like in June. Here we are, National Men's Health Awareness Month. Thank you both so much for kind of help covering such a unique aspect, like the obvious stuff of age, biology, what T is, but like the emotional stuff as well, the feeling attached to it, the identity attached to, I want to be a partner, I want to be a husband, a father, here and now, but in the long run. And for me, it was, I want to enjoy the things that I used to enjoy.
Yeah.
And I think being a guy, that's really important. I mean, for every human being, but especially when it comes to the man stuff, of being active and moving weight and just not feeling tired and, looking our version of good, like that gave me back so much of that. Mm-hmm. But I want to ask you guys another question before I get to my final question. Outside of everything we've been covering, what would you both pass back to guys now as like, you know what? As a guy, this has helped me tremendously in my personal health and wellness. Like, what's a men's health tip, a pro tip, an anecdotal tip that you want a guy to really know and maybe take home and apply?
Go ahead.
In your physical self, in your emotional self, in your relationships. I mean, sex. I mean, anything.
Yeah,
spiritual.
I mean, I say this to most individuals. It saved my marriage, right? It. One thing that I think is important to know, my wife and I, we had a really, really rocky fertility battle. We had 4 miscarriages in about 2.5 years, right?
Yeah, that's rough, man.
Yeah, it was super rough. And, of course, my role is to take care of my wife and be there for her. But there's a lot of things that happen to a man when the woman is conceiving.
Totally.
And there's markers like cortisol goes up, testosterone drops tremendously, and nobody talks about that. But if I could give, a little bit of advice is just know your body and know that there are options, right? Aging doesn't have to be a difficult process. Like that whole, you're just getting old. I don't like that shit.
I refuse to accept
exactly.
That.
Like I feel like
to a certain degree, but right.
Everybody's seen the meme where they show like what old people look like in the 50s, in the 60s, and the 80s. Dude, I want to look good. I want to look like Sylvester Stallone when I'm 70, right? There's just options out there, and it could dramatically change your life. In my case, it saved me a divorce, right?
Oh, nice.
And that is a fact. And if my wife was sitting right here, she'd echo that fact.
Hell yeah, I love it.
So it's a good thing, and embrace it. No, understand the process, right? And just take it one step at a time.
That's awesome. Thank you.
Yeah.
Thank you. Yeah.
So I would add to that. So for men, because I've been in healthcare like 20 years, and it just so happens that I say 90% of my patients have been women. And I think what the problem is with guys is we don't prioritize health. We procrastinate. We have the don't fix it unless it's broken. So I think guys need to kind of like put their health as a priority. Don't procrastinate. Don't wait until it's broken. Don't wait till symptoms.
Don't wait for a symptom. Yeah.
I ask guys all the time, have you had labs done? No. Get checked. Get checked now. I mean, it doesn't matter if you're 25, 35, get checked, because we see guys in their 20s, low testosterone, low other things. So prioritize your health. Don't procrastinate, and get checked, and just be aware and take ownership of your health. And I think that would be huge for us guys to kind of like, just do that.
That'd be great if we could do that more.
Yeah.
I think, it's studied. I mean, men are 25% less likely to go see a physician. And I think the psychology starts at a very young age. You're told to man up, right?
Totally.
I think when it comes, exactly. When it comes to health, if it's not for you, do it for your family, do it for your friends. We all have a family member or friend that it was a notch on their belt that they hadn't seen a physician in years, right? I'm not saying you have to be at every appointment just to proactively check it, but take some responsibility. And if it's not for yourself, it's for your family, right?
Absolutely.
Because it can save your life.
Because who does it affect? It's like he said, ask his wife. It's the family members that notice.
Yeah. Unless you're living by yourself in a cave in the middle of nowhere.
Exactly.
Cool. Like,
right.
Don't go see the doctor.
Exactly.
But it's not about you.
Not about you.
Yeah.
When you've made those decisions to be a partner, to be a father, to be a business owner, to be whatever, like, you have a ripple effect.
Totally.
Absolutely.
And I'm glad you brought that up because it reminds me of like bottom line, the most important thing I think in our health is when we have a symptom or we're just looking to really get a baseline, basic metabolic labs do such wonders. Yeah. That is the first thing. Anytime when I talk about my TRT journey with you guys, besides psychedelics, I have never gotten this much feedback on anything.
Nice.
Because I share like the weight that I'm doing in the gym, like my body's been changing. I get so much interest in this and people are like, what's your dose? What are you doing? Right. Where'd you get it? And the first thing I say is, what are your labs?
Right.
Like, what's your age? What was your last lab count? And then luckily I can be like, Blokes can actually do that for you too. But I think, and that actually catches a lot of the guys off guard. They're like, well, what? Like, no, just like, tell me what you're doing. Yeah. Like, no. I can refer you. And then the process is they're going to do labs if you haven't done them, but you got to first know thyself. Yeah.
Not to add to the tips, but be honest, right? There's something called white coat mentality, right? And this is in all healthcare. The white coat walks into the room and you just clam up, right? The more honest you can be about what's going on symptomatically, the better we can treat you. Exactly. And that's for anything, right? Yeah. Don't clam up and just because the white coat walks in, they're there to help. We're here to help. So.
Well, beautiful. Now I do have my final question for you guys. All this stuff, I think, especially for guys now, is like literally helping us move forward in life, get back into motivation and just literally be able to move well, be ourselves again, but to live a life ever forward. I'm curious, what does that mean to you guys? Josh, let's start with you, man.
That's a good question. For me, it's relentless in the pursuit of whatever it is, right? We're in this startup mode and there's so much noise and there's so much feedback, good, bad, ugly, right? But it's relentless in what we set forth and in life and everything. So if I'm living relentless in my pursuit of whatever I'm pursuing, that's ever forward.
Dr. J.
Yeah. I love ever forward, that phrase. So for me, I kind of, when I think of it, what I'm focused on and focus on the horizon, what's ahead. I also think of like just a posture, if somebody's not focused on the horizon, they might look down, or so having good posture and having confidence and just, just keeping going. I mean, like you said, we're in that startup phase. We've been through some struggles, but we just keep going and we know that this is going to take us to better places and we're going to help a lot of people. So that's what it means to me. So helping people and changing lives.
Yeah. Well, you guys are, thank you again so much for what you've done with me. It's been an incredible experience and still is. And thank you so much for coming in here today to do this.
Thanks for having us.
Yeah.
It's been awesome, man.
Thank you.
Thank you.